Good morning and welcome to another edition of CCH Check Up brought to you by Cairo Community Hospital. Today we have joining us Dr. Dante Loo. Dr. Loo is new to the Caro Medical Clinic and today we'll be getting to know him. Thank you for joining us today, Dr. Loo.
I'm glad to be here.
And let's first get to know you. Tell us about yourself a little bit.
Okay. I graduated with Doctor of Medicine from the Far Eastern University in the Philippines after 1 year of medical internship at the United States Naval Hospital at Subic Bay, also 6 months of residency at Clark Air Force Base in the Philippines. I came over to Detroit at Wayne State University, where I finished my internal medicine residency and some training in nephrology, after which I came to Cairo.
And how did you end up in Cairo?
Well, when I was doing my residency during my second or third year, I moonlighted over at Cairo Hospital 1 weekend a month. Just as I was finishing my residency, Mr. Corday, he was the CEO of the hospital then at that time, asked me if I would like to stay and asked me to stay because their doctor that was running the emergency room and outpatient clinic was going to Florida. So I said, sure, that it's a nice town and I like the people. And so I stayed, moved over here in July of 1980 and never left.
And you chose internal medicine. What made you choose that path?
I like reading mysteries. And to me, the closest thing to a mystery and detective story is internal medicine. I didn't want to go to surgery because I didn't want to wake up early in the morning. Internal medicine is like solving a mystery because the patient gives you clues. You can get the clue from their history, from their family history, from signs and symptoms, from physical examination, and then you can confirm it with your laboratory examinations. It's very rewarding when you finally get the diagnosis, especially if other doctors have missed it.
And what diseases do you usually deal with?
Being in internal medicine, I deal mostly with adults and senior citizens and older people with their usual diseases. They have diabetes, high blood pressure, heart disease and heart attacks, cancer, COPD and emphysema, kidney diseases, any kind of diseases that don't need any surgery I can deal with. And if anybody needs surgery, I usually refer them to the surgeons.
Okay, well, I want to thank you once again, Dr. Loo, for joining us this morning on CCH Check Up. And you can stop into the Caro Medical Clinic and welcome Dr. Loo to the clinic. And as always, you can tune in next week for your next edition of CCH Check Up brought to you by Cairo Community Hospital and visit cch-mi.org for more information.